Thank you, Mr. Chairman. Thank you very much for the panel. So we have millions of veterans, and a rather large percentage of them have PTSD. And according to the Wall Street Journal article, nearly 60% of VA patients with PTSD, and I don't know what that translates it into numbers, but they say that's over 500,000 patients. Are each of these veterans with PTSD supposed to have an individual treatment plan? I don't know who to ask this question to. Yes? No?
Yes, I think that having an individualized approach to treatment yields better outcomes.
I know that's not my question, though. Do each of these have over 500,000? Let's just focus on the veterans with PTSD. Do they each have a treatment plan? And who's supposed to come up with a treatment plan for each
So
of
if
these
they're
veterans?
diagnosed with PTSD and being treated, then they are required to have a treatment plan that is created and monitored by their healthcare team.
And Dr. Fletcher, you deal directly with the veterans of the two other panel members. So do they have individualized treatment plans?
I would say that that varies across veterans and across
sorry?
different.
What?
I would say that that varies. I can't speak necessarily for all of the veterans. We typically hear that when they're afforded the opportunity to have the access to this evidence-based treatment, that it can be individualized, but it's not always.
Well, when you think about the number of veterans we have and their medical needs, and they go to VA, it's just astronomical. The needs are astronomical. And at a time when there have been pretty significant cuts to VA, which always had a shortage of providers, isn't that true? I mean, in Hawaii, they're always trying to hire people for the VA. So there's always been a shortage. It's been exacerbated with this regime. Isn't that so? That shortage. Somebody?
So the OIG publishes a report annually on critical staffing shortages, and for the past 8 to 10 years, I can't remember exactly, but this year, yes, you are correct. We've noticed the most significant increases in those critical staffing
at the same time
shortages.
as I think Dr. Fletcher GAO, I think you said that there needs to be, yes, more oversight. And when you have the staffing cuts, et cetera, who's supposed to provide the oversight that you are recommending? This is for Ms. Hundrup. Am I pronouncing your name
Yes,
correctly?
no, that's correct. Yes, no, that
So you
is,
say more oversight is needed, but there are massive cuts to VA. Who's supposed to provide the oversight
well,
for the medical care of the veterans?
right. I think that that's where there is a level of oversight to ensure, because as I mentioned, if you have a policy or a requirement, it's only as good as the
No, but
implementation.
you're saying that they need more oversight, but there isn't more oversight. In fact, I would say there's less because there are cuts. There have been cuts to the VA's capacity to provide care. So what I'm seeing is that I commend you all for pointing out the needs, but how are the needs supposed to be met when the VA is actually making pretty significant cuts to an already strapped healthcare system, the biggest healthcare system in the country? Let me move on to, I don't know how the veterans are supposed to receive the kind of care they need when there are cuts to the provider base. Ms. Fletcher, I was intrigued by your saying that veterans would like to have alternative kinds of care. And is that a fruitful avenue for us to support and pursue if we're not going to have all the mental health providers that are necessary? Non-traditional services? Are we doing something to provide those kinds of programs?
I think that there is absolute value in pursuing research to support these alternative therapies. What we've typically heard, again, is most of the warriors that we serve are willing to avail themselves to the frontline treatments that are already available. What we hear is they seek these alternative therapies when what they've tried hasn't worked. And we always want, and so a commitment to innovation in mental health care is absolutely needed.
Do you think that that is a fruitful way to go? But because we are lacking, the VA system lacks providers, especially I would say mental health providers, maybe primary care providers. But if we can create an environment where alternative kinds of support can be provided, is that a fruitful way for us to proceed?
Yes, I do
Fletcher?
believe there's value in pursuing alternative therapies.
Well, that may be one of the ways to go when we lack resources. Thank you, Mr. Chairman.
You're welcome. Or she.